The Honourable Mark Pearson.
Thank you, Mr Deputy President. Xenotransplantation. It is the transplantation of living cells, tissues or organs from one species to another. There are currently xenotransplantation experiments occurring at Prince Alfred Hospital using baboons from the Wallachia breeding facility. A recent media expose described Frankenstein-like operations with the transplanting organs from pigs into baboons. Millions of dollars of taxpayer-funded research grants are being used, but the hospitals are not required to provide publicly available details about the nature of these experiments. Questions to the Minister have failed to yield answers. Human-to-human organ transplants are now routinely performed on patients with organ failure. Australia is a world leader for successful organ transplant outcomes, but we are only 22nd highest on the international list of organ donations. Public awareness is, however, improving. In 2015, there were 435 organ donations to 1,241 patients, the highest since national records began, with 69% of Australians willing to become organ or tissue donors. To increase donation rates, the federal and state governments have implemented a national reform plan, a world best practice approach to organ and tissue donation for transplantation. Its aim is to increase clinic capacity and capability, and to increase community engagement and awareness in relation to organ donation. Unfortunately, the current rate of organ donation does not meet demand, and this has been used to justify xenotransplantation with animals, predominantly primates and pigs. Xenotransplantation is a death sentence for all these animals. If xenotransplantation ever becomes a surgical practice, there will be mass wastage and enormous suffering of animals. Tens of thousands of animals will die miserable deaths in laboratory conditions. Sentient beings are reduced to nothing more than a spare parts warehouse. Xenotransplantation causes serious impacts on animal well-being from the moment the animals are born. They are unable to express their natural behaviours and suffer frustration, deprivation and stress. A significant stress factor is the sterile conditions in which the genetically engineered animals to be used for transplants will be kept. To reduce the risk of exposure to disease, sows have their pregnant wombs removed with the piglets placed into a sterile environment, unable to suckle from their mother, medicated and reared on artificial foods containing no animal products. Aside from the animal suffering involved in xenotransplantation, there are serious human health risks with the procedure. Possible problems with transplantation of whole organs from animals to humans include viral diseases transferred from animals, rejection of the organs by the patient's immune system, differences in structure and biochemistry between human and animal organs. Pigs contain endogenous retroviruses that are passed on from offspring in the DNA of normal chromosomes and therefore can't be eliminated. Viral sequences in host DNA can be activated to produce infectious viruses that are closely related to leukemia viruses in mice, cats, gibbons, and his second cousin to HIV. The following are examples of diseases transferred from primates to humans. Monkeypox, a virus originating in African monkeys, spread to humans causing a 10% fatality rate. The HIV/AIDS virus is thought to have come from the primate simian immunodeficiency virus. 7 laboratory workers died after being exposed to Marburg virus from African green monkeys. Ebola virus, which recently killed thousands of people in Central Africa, has been linked to monkeys. Herpes B virus, in a common infection of macaque monkeys, but in humans it can develop into a fatal neurological disease. Given the terrible animal suffering, massive wastage of sentient beings, the risks to human health and the expense involved in experimentation, wouldn't it make much more sense to save money and have much more compassionate outcomes for all beings if we were to focus our efforts on and resources on community education programs to promote organ donations. And this speech materials have been sourced by Dr. Suzanne Pope.
Thank you. Mr. David Shoebridge.